Welcome back. Not only are we dealing with a pandemic, but the American Red Cross says we're in a blood crisis that may put patients at risk. Joining us now is Marcia Antipa, a spokesperson for Red Cross Public Affairs. Marcia, thank you so much for joining us. You're calling it a national blood crisis. Just how bad is it?
Yes, Kristen, first of all, thank you for having me on. And yes, it's something that your viewers should know about. The American Red Cross is facing a blood crisis. In fact, there's been a 10% decline in donations since the pandemic began. There's also been a 62% drop in drives at schools and colleges. So you can imagine the donor turnout has just plummeted. Now, donor turnout and donors fluctuate all the time, but the need is constant. In fact, we've gotten down to a one-day supply in recent weeks. And that makes it very difficult for the Red Cross to supply hospitals, and doctors have to make difficult decisions in order to decide who is going to get those blood products.
When you say one-day supply, are you talking about Northern California?
No, we're talking about nationally.
How about here?
And here it's about the same.
Okay.
We're seeing the same thing. And that's because of the pandemic, many people have not come in to donate. Mm-hmm. And you know, something else, we do have a staffing shortage, just like every other employer during the pandemic. And so the Red Cross is looking to train phlebotomists who will be paid. They're also looking for volunteers to help staff those blood donation drives and those blood centers.
Okay. I wonder if elective surgeries, you know, we're hearing a lot about elective surgeries being postponed due to the COVID surge. Does that buy you more time at all to procure blood?
I imagine it does, but that is really a question for the hospitals. We provide the blood to the hospitals, and it's their decision as to what types of applications they'll use the blood for, what types of surgeries are considered urgent, and that type of thing. But do keep in mind that every 2 seconds, someone in the United States needs blood. It's interesting you should ask about surgeries, but actually there are daily needs for blood. For example, traumatic accidents, sickle cell patients, cancer patients, and even people in childbirth.
Yeah, you're
Here
right.
in Northern California, yeah.
And for a while, you know, demand was down a little bit during the early part of the pandemic when people were not going out, were not engaging in normal activities, but that's back in full swing. So I know the demand is back. So can anyone donate for those who want to help the situation? Talk about that, you know, and what about people who have tested positive and they've recovered? Can they donate?
Yes, what I'm going to ask people to do, because there are many things that affect eligibility. First of all, people need to know that it's okay if you're vaccinated. It's just that the blood drive center will want to know what type of vaccine you had. And all of your questions can be answered by going to redcrossblood.org, because there you can find out your eligibility, go through the process of giving blood, what it involves, the fact that our blood centers are safe, there's social distancing, there's masking, and
Marcia, I don't want to cut you off, but we have about 30 seconds, and I know you want to talk about the incentive you're dangling for people to donate blood right now, and they have to do with the Super Bowl, so tell us about it.
Yes, and go 49ers, right?
Yeah.
No, we just wanted to say that in the past, the Red Cross has done this as well, but if you are able to come in and donate during the month of January, you will be entered in a drawing to get 2 tickets and a trip to the Super Bowl in Los Angeles. So we hope that's enough of an incentive, but I know that people out there also want to give with their hearts and realize there's a need.
So redcrossblood.org is the website. Check it out. Meantime, join us on Facebook Live to continue the conversation. We'll be right back.
In commercial break.
Okay, so Marcia, we're done with the on TV portion, but we're still on Facebook Live where we stream our show, so we can chat we can chat just a little bit more. Okay, so if you donate blood between what period and what period, you're eligible for the Super Bowl raffle?
Between now and January 31st.
Okay.
And
and anywhere you donate blood, doesn't matter?
Anywhere, right. and through the Red Cross.
Sure.
And you can also call 1-800 Red Cross if you can't get what you need on that website. 1-800 Red Cross. A live human being, a very nice person, will answer and talk to you and help you out.
No doubt, very nice. Just to talk about eligibility a little bit more, I know if people go to your website, they can get all the information. And you did tell me that people who are vaccinated are eligible. But what about people who just recently had COVID? Like, what is the rule there?
So I don't have that exact rule, but I
okay.
can find out for you, Kristen, and get it to your viewers and get it to your Facebook page.
That's what I always tell people too when I don't know something. I'll get back to you, and I definitely will.
Yeah.
Okay, because people just want to know, because obviously that affects a lot of your potential donor pool right now. So.
Sure.
Okay.
The other thing that I'd like. Oh,
go ahead.
I just wanted
please,
to tell you that in terms of people who need blood, there was a mom here in California who in July of 2020 had an emergency cesarean section. She started bleeding uncontrollably, went through the entire hospital supply of blood. There was no blood within 45 miles. She had to be airlifted in order to get to a hospital where she could have enough blood. So that shows you the level of need.
I sure hope she ended up okay, and I hope nobody else ends up in that situation. Thank you so very much for reminding us that the need is still there. You know, the pandemic is here, but we still need blood. So redcrossblood.org is the website you should check out. Okay, thank you so much, Marcia. I really appreciate it.
Thank you, Kristen.